Doctor, that was most inspiring, and it's delightful to have a man of science also look at the other side. And especially your concept of wellness and in anticipation. Continuing with that part of your expertise, I'm sure all of us over here, one time or the other, will land up at your clinic or one of your many clinics. I have no doubt about that. But before we do that, let's talk of the most common problems we face. Cancer, as you've mentioned in our fear, not you, but our speaker last week, and then stroke and heart. Give us three pointers as anticipation, say for cancer, so that we know what we are in for, and then we come down to you for help.
It's like trying to tell the entire Ramayana and Mahabharata in like 3 lines. I don't think that I can give you the answer that you're looking for, to tell you the truth, because I know that if I did, I would be not doing full justice to the topic. But I'll give you some pointers. When you look at any disease, any major chronic, modern, urban, whatever you want to call disease in current days, there are 3 factors that always come up. When you look at a disease like cancer, the only thing that modern medicine can tell us about cancer is that at the right age, do the right screening. But, and I believe that we aren't doing enough screening in many cases, but there is enough going on that. I'm not saying that it's not being done. But I feel that even despite screening, we are seeing new cancers at ages that we don't expect, in places that we don't expect. So how much screening can you do? And so what it comes down to is, if you look at cancer as a dysfunction in a cell, which your immune system has missed, which means the immune system is not working right. When the immune system is not working right, it means your digestive system is not working right. And like was mentioned, the neuroendocrine system is not working right. And so in this, it all comes down to diet, lifestyle, and having a balance with regards to, instead of having distress, having de-stress in life. So rather than telling you 3 pointers of what you can do to screen for these diseases before they happen, I will say that look at these 3 aspects of your life. One is diet, one is lifestyle, and the third is, are you giving enough time to yourself to unwind and release what each one of us go through every single day in our lives? Because when this accumulates enough, that's when the neuroendocrine goes out of sync, and that's when the immune system goes out of sync, and then where it will target is your genetic risk and probability. If you have a strong family history of disease, it will end up in heart disease. If you have a strong family history of stroke, it will end up in stroke. If you have a strong family history of cancer, it will end up in cancer. Now, in diet, there is a very wide spectrum. And like I said, become aware of what you're putting in your mouth. That's the simplest message that I can give you in today's lecture. Simplest and most essential lecture. Most important point. Understand what you're eating. We've come to take, anything that comes in a nice packaging with a branding and a good labeling is supposed to be clean and good. I say that that is not true always. We are taking in so many chemicals, so many adulterants, so many toxins into our system every single day. If I were to enlist, and I actually did this when I was first getting into this, right from the time we wake up in the morning and we brush our teeth, if you count the number of chemicals in your toothpaste, all the way till the time you go to bed at night after brushing your teeth, and look at the number of chemicals you're exposed to, it's about 150 to 200 chemicals that we are exposing our body to every single day. And many of them have been accepted and approved and labeled as being safe, whereas no one knows. I would even say something as simple, babies drinking bottles. For years together, we felt that they were safe, the plastic bottles. Recently, they found out that bisphenol A, a chemical that has now been tied in with cancers, exists in those, and they had to entirely revamp the whole industry and change how it was produced. Like that, I'm saying in everything that we're doing, right from the non-stick pan that we use to everything else, we have to wake up and understand what it is that we are doing. This is only a process of awareness. Disease is a process where in awareness actions have occurred that have led on to an end result. And so the one message in this is diet, diet, diet. Then lifestyle, and then whatever you take as de-stressing, meditation, prayer, yoga, pranayam, whatever you believe in as your process of de-stressing. These three things would be key.
Dr. Roy, on behalf of the club, it's my pleasure to present you a memento to remind you of the afternoon you've spent with us. Thank you so much. Thank you.